inspired, 3 years and beyond. I stand before the community of scholars of the UP College of Medicine, humbled by the challenges during the past 3 years as the academic leader and dean of our beloved alma mater. Many of you have heard the Inspire flagship program, which we embarked on in 2018 as a shared aspiration. The journey has not been easy, especially in the past year, battling an invisible enemy that has affected all of us. For the next 3 years, the Inspire flagship program will be relentlessly pursued. I for infrastructure. In 2018, 3 months after I started as your dean, UP President Danilo Concepcion approved the site for the new Medical Sciences Building, and through our generous donors, the foundation was laid even in the midst of an ECQ, and this March 2021 marked the topping ceremony. Thus, come this December, on the 116th year anniversary of UPCM, a new Henry C. Senior Medical Sciences Building, an iconic building solely built on philanthropy, is envisioned to have a soft launch and pivot UPCM to another century of leading our nation to a new era where transformative medical education further serves our vision of excellence and leadership in community-oriented medical education directed to the underserved. We owe so much to the combined efforts of the UP Medical Alumni Foundation President and UPCM Professor Emeritus Dr. Roddy C., assisted by former Dean Agnes Mejia, and our very hard-working Associate Dean for Planning and Development, Dr. J.J. Cruz. Meanwhile, the basic science departments such as anatomy, pathology, biochemistry, pharmacology, and physiology are all under variable stages of renovation, so within the century-old buildings will be modern facilities for laboratories and enhanced educational facilities. Aside from the brick-and-mortar infrastructure projects, what truly prepared us were the investments we made in building our virtual campus through the digital transformation of the UP College of Medicine that started in 2019. With the new EduTech unit and IT support through the efforts of Dr. Arsenio Cabungcal and Dr. Philip Foliante, we have been able to make headway in the IT and digital resources. Our web portal has all the learning platforms and is a repository for memoranda, thesis modules, access to HRIS, the Inspire magazine that informs our community and stakeholders about other resources made available within a secure and data privacy compliant web portal. It even has a whole COVID tracker for our community and guests, as we already had limited face-to-face classes for first-year medical students in July. As for science and discovery, collaboration breeds creativity, and innovation proven by my experience where engineers and clinicians worked before for the Hearing for Life project of the Philippine National Ear Institute. This came about on the heels of our institute's researches and evidence-based advocacy that led to a law that mandated universal newborn hearing screening in our country in 2009. Using this model, the research program under UP College of Medicine was approved for funding of $146 million for 2020 by DOST that got delayed to 2021. However, Dr. Edward Wang led the Civil Task Force on COVID over a weekend with projects like PAPR, sanitation pods, telemetry using RxBox, and telekamusta robots that were deployed to PGH to help in the fight against COVID-19. In the same weekend, my frantic call to Dr. Buddy Austria, who invented the Austria Vent for neonates, led to the decision and fundraising to develop the Austria Vent 2 for adults. There were 3 other ventilator projects that were accelerated after we realized last March 2020 that we only had 1,700 ventilators in the whole country. Through Associate Dean Dr. Marisa Alejandria, UIDO has reported total funding of over $1 billion for about 70% of the UP Manila COVID researches that were performed by faculty, trainees, and students in UP-PGH. Our researches have not only come in bigger numbers, but for the past 3 years, the faculty have contributed immensely to improve rankings of the university with high citation scores beating other world-renowned universities. We had the honor of conducting the WHO Solidarity Trials for COVID-19 therapies and vaccines in the country, while our faculty served with dedication in the expert panels for HTA, vaccine reviews, the IATF subcommittees, yet continue to teach our students and share their expertise in the virtual conferences, webinars, and lay fora to better inform the public and policymakers. P for Partnerships for Progress. Our MD-PhD program, thanks to Dr. Leslie Dalmacia, was given a 3-year grant for operational enhancements by PCHRD, such that our MD-PhD students got involved in new exciting research programs and projects under the MORPH, with 136 billion in funding, the Field Diamond, and almost 140 million grant funds. This strong partnership between UPCM and PGH in clinical services, postgraduate education, research, and faculty development will be even more felt as we see the realization of the Center for Clinical Simulation within the next 2 years in one floor of the Medical Sciences Building with Dr. J.J. Hermar and Dr. Anthony Perez at the helm. To facilitate remote learning for some of our disadvantaged students, we have partnered with Smart Globe for the provision of mobile loads to about 189 marginalized students. Thanks to Mondinisin, Mr. Lito Abrogar through Dr. Alexis Reyes, and several alumni groups, more than 110 tablets and laptops were loaned or lent to our student scholars for free and renewable yearly until they finish their studies. All scholars of UPMASA were also provided these laptops. Thanks to the UP Medical Foundation and the UP Medical Alumni Foundation, we were able to provide medical assistance to faculty, students, as well as administrative staff. We also provided quarantine facilities in our classrooms to PGH staff and healthcare workers, clerks, and interns as an added assistance for safety. Through the Mu Sigma Phi fraternity and sorority, the UP Medical Foundation and other donors, much-needed PPE, alcohol, masks, face shields were provided to our students and staff. The college actively participated in programs of UP Manila, such as the Bayanihan na Operations Center, and testing capacity for COVID improved with about 20,000 PCR kits donated by Mondinisin to the Temasek Foundation of Singapore, along with 2 other automated PCR machines for improved testing turnaround time, and ultra-low biofreezers from the UP Medical Foundation were provided to both NIH and PGH MRL, which are our 2 DOH-accredited molecular labs in campus. Innovation and leadership in transformative medical education. The UPCM has always been recognized as a pioneer in medical education, having introduced the ladderized program of HSS, the Intermed, the Organ System Integrated Curriculum, as well as the MD-PhD program. These past 3 years, the Postgraduate Institute of Medicine not only took care of the CPDs, but was able to stage the second Patient Safety Congress and initiate the next GSS for September 23 this year, as well as with Dr. Jean Toral, former UPMAS president, the creation of the first UPMAS chapter of Davao. Thanks to the Postgraduate Institute of Medicine led by Dr. Teresa Luisa Gloria Cruz, we are on track with the many curricular reforms for our graduate offerings, and our graduate student population now comprise more than 300 every year. We also are in the final stages of developing the dual MD Masters in Clinical Epidemiology program, the MPH program, and working with the clinical departments in PGH for the MD Masters in Clinical Sciences as academic tracks for medicine. We have participated in novel programs that were initiated at the UP College of Medicine, like the PhD by Research, and this year we will have our first graduate for the PhD by Publication in the person of Dr. Dom Hamora. We have already finished substantial work for crafting degree programs for those interested in an academic track for residents and fellows, who will in the future add to the cadre of clinician scientists that come rarely in a country that really needs them. The digitalization of our medical education was enhanced greatly by the donation of the Phi Lambda Delta International, the Phi Kappa Mu Alumni Association, and the Phi House Foundation, as well as other alumni with the MORPH virtual human dissection tables and visualizers for anatomy. Thanks to the vision of Associate Dean Coralie de Macali, our investment in video capture learning platforms such as Panopto, and former faculty and visiting professor Dr. Rosalinda Milla, our first training on Canvas was initiated through the UPMASA UPCM Visiting Teacher Program way back in 2019. This learning platform is now one of 2 learning platforms in use in addition to the BLE of UP Manila. The College of Medicine, in partnership with Harvard Medical School, offered the HMX online modules in biochemistry and pharmacology, and we are now in our second year. We have also augmented our library collections and with online resources with a huge collection and enhanced by a $10,000 donation from Dr. Eusebio Co, as well as the UPMASA. We are now fundraising for the new Dr. Florentino Herrera Jr. Medical Library to be housed on the third floor of the University Library that is now under construction. The college has likewise participated in the meetings with the Association of Academic Health Centers International and the Harvard Medical School for the Impact Symposium, where we shared our best practices in the recent symposium. Our graduates have done well as we continue to have highest passing rate for the physician's licensure exam. And last year, 9 of our graduates were in the top 10 of the physician's licensure exams, including the top number 1 spot. The Hiraya class of 2020 held the first ever virtual graduation in the College of Medicine, and this year's Salimbay 2021 was also a hybrid event. R for resource generation. Our fiscal position greatly improved with the fresh funding from all fronts, whether private or government, alumni or friends. The true Bayanihan spirit that remains at the core of our cultural ethos became even more clearly evident. We are grateful for the additional resources of almost 400 million raised for the medical sciences building the past 3 years, and almost $1 billion from government for the myriad of projects and research programs that we have initiated. E for empower and embrace wellness. We have recently launched a major leap at UPCM. Learning enhancement in an academic program includes the BLEAS, or Blended Learning Initiative, for scholars led by Medical Education Unit Dr. Hazel Manapat Reyes, that also provided much-needed boost for the delivery of course packs, trainings for course redesigns, and even the provision of gadgets and laptops for our students and departmental staff to facilitate remote learning. It includes the HMX Online for Biochemistry and Pharmacology, as I mentioned, the AMBOS subscription for LU5 to LU7, and also the faculty staff. More than at any other time, Associate Dean Dr. Chet Gonzalez had exerted great effort in supporting the needs of faculty and students. We have managed to continue providing scholarships for many students and for young faculty to enroll in emerging fields needed such as patient and quality assurance, as well as PhD in oncology. Thanks to the Special Assistant to the Dean, Dr. Tonet Habana, the college was able to put up a crisis management team working in close coordination with the students, and our Office for Resiliency with Dr. Jojo Lee Uson and Dr. Benjamin Sablan, the mentoring committee also led by Dr. Josie Isidro La Peña, was able to cater to an increasing number of students whose mental health had to be supported, especially in the past year of this unprecedented crisis that actually rages up to now. Indeed, the times have remained challenging, but vaccination has provided us hope.
Ay, wag na pala ganapin ang ganitong misinformasyon sa ating publiko. Dahil malaki na po ang problema natin sa COVID, wag na po natin dagdagan pa. Ang masasabi ko lang po ay hindi po totoo na ang bakuna ay mas delikado pa kaysa sa COVID-19. Ang COVID-19 po ay nakamamatay, pero kung kayo mababakunahan, maiiwasan po natin na kayo ay magkaroon ng severe or critical COVID, na mangangailangan po na kayo ay tutubuhin pa sa mga ospital pag kayo dinala doon.
And following proper guidance, we were able to conduct face-to-face classes safely. We just recently held a successful learning enhancement program in anatomy with dissection by the majority of our vaccinated students and faculty with prior testing. We actually take pride that the first face-to-face classes in the country for medical students were conducted here in our campus, and this bridging program in anatomy serves as a model for other medical schools. They were able to prosect silent mentors or cadavers and could handle, in reality, the organs, and the 150 vaccinated first-year medical students were able to partake of this thanks to the leadership of Dr. Pio Villacorta, Department of Anatomy Chair, and project leader Dr. Jose Texon. By embracing the issues with humility and understanding, we have nonetheless stood for unity in diversity. We remain committed to our values and our promises to our countrymen, whose health we vow to improve even at the cost of our lives. The triumph of science over death, the stance as Lady Med in our front yard, with no less than our national hero Dr. Jose Rizal, who sculpted this, serves to remind us that our struggles today will bring us one day to that moment of victory. It is said that thousands have walked along its hallowed halls, and those who will be chosen to join this community of scholars at the UP College of Medicine will be welcome to partake of the history of honor, excellence, and service to our nation and the world. I would like to end by sharing the message of former Chancellor Dr. Marita Reyes, also former Dean, as she shared her wish for the college during our 115th Foundation Day.
Warm greetings to everyone on the 115th anniversary of the UP College of Medicine. This year, amidst the COVID-19 pandemic, the college has been proving its mettle in many ways. When its students, faculty, and staff continue to care for infected patients at the risk of their health and even of their lives. When they actively participate in social, epidemiological, and clinical research to help clarify the nature of and to discover therapies against infection, and when they demonstrate authentic leadership in various committees and agencies to frame and develop policies and programs to help prevent COVID infection and its transmission. Truly, the tradition of heroism in the UP College of Medicine continues to shine inspiringly bright. On the occasion of its 115th anniversary, I wish that the college will continue to be loved by its constituents, cherished by its graduates, honored by the Filipino, and respected by the rest of the world.